Good afternoon, and thank you so much for your interest in our research. I'm Teresa Martin. I'm a nurse, and I am a BSN candidate at Cal State Fullerton.
And my name is Sabrina Mahoney, and I'm the Training Institute Manager at the Mental Health Association of San Francisco, and I am an incoming MSW student at San Francisco State University.
Our research is rooted in three ideals that we hold very close. First, a collaborative spirit. Second, a multidisciplinary approach, hence a nurse and a social worker. And third, that all medical models of care are community driven. Hence our third investigator, Deshawn, a community caregiver who could not be with us today. She's unfortunately attending her own mom's passing, but she's given us this incredible design that you see on the center of our poster. It really captures the two main themes that we'll talk about a little bit later in our presentation about community and caregiving as a transformational process. Sabrina will tell you a little bit about how our study was conducted.
Amazing. All right. So traditionally, research in caregiving focuses on the caregiver's experiences and how systems can support caregivers to continue doing the work. The purpose of our study was to understand specifically what variables must be present to make a patient feel well cared for, the caregiver feel effective in their role, and how that relationship promotes healing for both the patient and caregiver. So, how did we investigate this? Well, we chose 14 persons known to the interviewers to have been in the role of the patient and at other times in their life to have been in the role of an unlicensed caregiver as an adult. We allowed 1 to 3 hours to conduct each interview. Before our interview, interviewees were given 4 open-ended questions to guide our conversation, and we used reflexive interviewing techniques to explore responses in further depth and clarify themes.
Thanks so much, Sabrina, for that setup. As you can tell from what we've done, we walked away with mounds of data, hours and hours of Zoom footage, recordings, mounds of transcripts. What was most important to us was to uphold Lincoln and Guba's golden standard of analyzing qualitative data, which is so that at the end of the day, we could confidently state, this is what the community is telling us. In order to do this, we used Gene Watson's theory of human caring as our framework. This framework allowed us to assume that the caregiving relationship is critical in the healing process. When we looked at our answers to our 4 open-ended questions, we used both a phenomenological and a grounded data theory analysis. We came at it from both directions. We analyzed each interviewee's responses as both a patient and a caregiver to look at themes that were different between the two roles and themes that were pervasive across roles. What we found was incredible. We found 3 main themes emerging from both the literature and from our interviewees. First, we found that specific communication patterns were critical to promote the sense of healing. Second, that informal healing can only take place with a community of informal people around you and supporting you. And third, that the role of both the patient and the caregiver is something that unfolds over time. There's an evolution or transformation that occurs, and that transformation in and of itself is actually promoting the healing process. Sabrina will go a little bit more in depth in our first finding about communication patterns.
Thanks so much. So, within this theme of empathic communication, interviewees described that empathy needed to go both ways. When there is bidirectional empathic communication, not just caregivers expressing empathy towards patients, both the patient and caregiver feel heard and seen in a way that promotes healing. Participants described that the most effective relationships occurred when both roles sought understanding rather than seeking compliance. And I'll pass it back to Teresa to talk about our other 2 themes a little bit more in depth.
The second theme that really emerged in the research and in our interviewees was this idea of community support, specifically informal community support. First, think something like a healing environment. Think Florence Nightingale. Open the windows, make sure that the room is clean, make sure that you have enough resources in place to be able to promote a healing environment. The second thing that emerged was really this idea of a healing presence. Think Jean Watson now, that the caregiver herself or himself is providing this healing presence. Both of those themes we found in our interviews, but most importantly, what we found from both the perspective of a caregiver and the patient is that having a large community informal network of people around you is what promoted the sense of healing the most by a long shot. As you can see down in our graph here at the bottom, that is the tallest green bar you see, the frequency of times that people describe this idea of an informal care network environment around them, just showing up, bringing a meal, providing a healing space. That was a pervasive theme, the most pervasive theme we found in all of the research. The third theme that we found was a little bit surprising to us. We know that taking on the role of becoming a patient or becoming a caregiver doesn't happen with a diagnosis or saying, sure, I'll help you out. It happens over time. But what we found was that as it was unfolding over time, the sense of transforming into the role was perceived as a healing process, both from the patient and the caregiver's perspective. This is really exciting because there's this idea that if we promote this role over time through informal community networks, we can actually provide an environment in which healing can take place. It all comes back to our caregivers' design, that community promotes healing and caregiving transforms us. But what does this mean to the nurse and the social worker? Sabrina?
So like we have, explored with a lot of these themes and in our results, we're seeing a lot about the community, the caregiver, and the patient. So like Teresa was mentioning, what questions come up for us as medical and mental health professionals? What is our role in this really dynamic process that we're seeing unfold? So some questions that we were really wanting to explore and further research is how can we better community systems? How can we acknowledge this unfolding role that both the caregiver and the patient assume? And how can we work across disciplines? How can we dynamically support our framework that enables us to then support our community members? How can we work across disciplines to provide support across our fields? So we're really looking forward to exploring these in further depth.
And I think our next steps, our future research really is going to be a quantitative research process to be able to uncover a little bit more systematically what these variables are. The qualitative research that we did in this project really opened the door for us to explore new areas of medicine and social work. And that's really about trying to figure out systematically, how can we look at a quantitative approach to caregiving? What happens in the community? How can we survey the community members who are supporting a caregiver, patient dyad? How can we survey this unfolding transformative process? And that's really what's going to dictate our next research steps. Basically, how can a patient's community be best integrated into the medical system? And vice versa, how can the medical system be best integrated into a patient's community to ensure a well-supported and robust healing process? Thank you.